Hi, I'm Megan. I'm your nurse today. I'm just going to wash my hands and give you some privacy. And what's your name and date of birth, sir?
My name is Richard Barton. Date of birth is 04/1894.
Perfect. That's what I have too. Nice to meet you, Richard. I'm here to do a head-to-toe assessment on you today. Is that all right with you?
Yes.
Okay, great. So I'm just going to give you a quick look over, check some vitals, make sure nothing abnormal is going on, and be on my way. You ready?
I'm ready.
All right. So to start off, do you know today's date?
Today is April 4th, 2025.
Okay, and the time of day is?
Right now it's 2:41 p.m.
And where are you?
Right now I'm in Chicopee, Mass.
And what's going on here today?
I'm just getting a head-to-toe assessment.
Okay, great. So you're nice and alert and oriented. You know what's going on. That's a good thing. I'm just going to check your pupils. So if you just look straight, I can just check. And I'm just going to flash this. Don't look into it. Just let me do it. Right by your eyes. Nice, equal, reactive pupils. Always good to see. So I'm going to check your vitals. While we're here, this will check your pulse and your oxygen. And I will check your blood pressure on this arm. Your heart rate is a little elevated according to this. Oh, maybe it was just on wrong. And nice and low now again. Your oxygen is normal, 97, and your heart rate is normal at 87. Perfect. I can take this off, and I'm just going to do a quick, this will just squeeze your arm a little bit. And I'm just going to check your blood pressure. Perfect, 120/80. That is a textbook blood pressure, sir.
Perfect.
So while we're over here, I'm going to check your lungs and your heart as well, and also your abdomen. So first I'm going to start with your heart. Very nice. And now I'm just going to check your lungs. Your heartbeat was nice and strong and regular. Okay, I'll check the front of your lung. Now I'm going to check the back. Okay, and now I'm just going to palpate I'm going to listen to your stomach, and then I'm going to just palpate it a little gently. I'm going to start right here. Nice active bowels. In all 4 quadrants. And your lung sounds were clear as well. And now I'm just going to give your belly a light palpation. Is anything tender or sore as I push?
Nope.
Okay, and now I'm just going to palpate over your bladder. Just let me know if you have any discomfort.
Nope.
Wonderful. While I'm here, I'm just going to check your perfusion by pressing on your finger and seeing how fast your capillary refill is. And that's looking good as well. And Richard, do you have any allergies?
I am allergic to pollen, so seasonal.
Okay. And how about any food or medication allergies?
Just celery and apples.
Okay. All right. I can document that for you. And how are you eating and sleeping?
Well, I'm doing all right.
You're doing all right?
Yep.
You feel like well rested and
Yep.
you feel like you have enough energy to get you through the day?
Yep.
Okay, wonderful. That's great to hear. That is a good assessment. And so I'd also like to give you your body a look, see how strong you are. I'm going to check some pulses, and so I'm going to give you some more. I'm going to check your carotid artery. And then I'm going to check your brachial arteries. They're nice and strong and equal. And now I'm going to check your radial pulses and your femoral, equal and strong, and your popliteal, equal and strong, and your tibial, equal and strong, and your pedal pulses, nice and equal and strong. And while I'm down here, if you could just push your feet against my hands, show me how strong you are. Awesome. And then if you could grab my hands and just give me a pull, and I can see, oh, very strong. Don't pull me away now. And now I'm just going to check to see your range of motion. Let me know if you have any pain or discomfort or any resistance. Everything's feeling good and loose and free. Awesome. Let me just do the other side. A little cracky again. And then I'm going to check the range of motion on your legs too. So if you could just sit back for me and just let me know again if there's any pain or resistance.
Nope.
Awesome. We'll check this leg. No pain or resistance there.
Yep.
Great. So far everything's looking very normal. I'm just going to check the bony prominences on you to make sure you have no pressure sores. So I'll check your elbows, your spine, your coccyx, and then I would just give you a nice skin assessment as well, making sure your head, your face, your neck, your ears are all intact with no rashes. I looked at the back of your trunk. I would look at the front. I would look at your legs, your arms, and just make sure everything's good for you. Everything's intact. And you have no sores or injuries. Your fall risk is low.
Mm-hmm.
You are not at risk for falling.
Nope.
And could you get up and can I just see your gait, how you walk?
Sure.
So you have a nice steady gait as well. Wonderful. And do you have any pain today?
No, I do not.
So 0 out
So
of
it'd be
10?
0. Yep.
Awesome. All right, well, I think that's concludes our head to toe assessment for today.
Okay.
I'm gonna give you your call bell. Let us know if you need anything.
Okay.
I'm gonna make sure your bed rails are appropriate. Your bed is lowered to the lowest setting. Make sure everything's good. And you have that call bell. Do you need anything else while I'm here?
I think I'm all set.
Okay, wonderful. Thank you so much, Richard. It was nice to meet you.
Thank you. You as well.